Hi guys, welcome back. In this video, I'm going to share how to make your Medicare subsidised psychology sessions count and stretch further. Most people know that in December of 2022, the government reduced the amount of sessions from 20 down to 10. This was in spite of a report they commissioned recommending that the 20 sessions be kept. This video will help if you're currently in therapy or are planning to be in therapy and use Medicare to subsidise some of the cost of therapy. Let's dive in. Those that aren't aware, in Australia, individuals can receive a referral from the GP or psychiatrist called a mental health care plan that will enable them to receive a Medicare rebate for up to 10 sessions of therapy in a calendar year. So this scheme has been around since 2006. I started working in private practice in 2011. I was working full-time in the public mental health service and did one night a week, I think it was, in private practice. Back then, people could get up to 12 sessions and they could apply for an extra 6 in a calendar year under what they called exceptional circumstances. So there was a specific set of criteria that you had to be able to fulfill in order to get the extra 6 sessions. But most people could, well, everyone could get 12 sessions per calendar year. This reduced to 10 sessions for everyone with no exceptional circumstances in 2012. And in 2020, it was increased to 20 sessions due to the COVID pandemic and the increase in mental health problems that we've had from that over the last couple of years. And it was late December of 2022 where that number was brought back to 10. And that was despite findings from their own investigation detailing its effectiveness and recommending that the 20 sessions remain. So thinking strategically about how to really utilize those sessions to make them last, I've come up with 8 suggestions. As always, feel free to let me know if you have any others to add or if you've tried some of them yourself. The first one is university clinics. So any university that has a postgraduate psychology program is likely to have a psychology clinic. This is where members of the public can access discounted psychological treatment. You don't need Medicare to access this service, so you're not limited to the 10 sessions per year. And these sessions are run by postgraduate psychology students. They're in the early stages of their career, but they are under supervision. This is where I started in 2009 at the Griffith University Psychology Clinic on the Gold Coast. And it's not commonly known that this service, so the wait lists are often quite low at these clinics, so it can be a really, really good place to go if you've used all your 10 sessions and unable to afford the full fee without the Medicare subsidy. Number 2, private health funds. Not everyone has private health insurance, but those that do, if you have mental health cover or psychology cover, you can use that to claim for some of the cost of psychology. Each fund is going to be different in how much they let you cover, and I do know that some of the funds have a stipulation that you do need to have used all of your Medicare rebatable sessions before you can access a health fund rebate through the health fund. And the rebate does differ depending on level of cover you have with your fund. Anecdotally, most of the clients that I see tend to get a higher rebate back through Medicare rather than the healthcare fund. I think there's only been one client that I know of that has had a higher rebate through her health fund. Number 3, seeing a psychologist during the second half of the year rather than the first. So keeping in mind that the 10 sessions is per calendar year, if you were to start therapy say at the end of July and then were to have fortnightly sessions, you'll use up your 10 sessions by about mid-December, and that's factoring in if you or your therapist aren't sick, no one goes on holiday at any time between then, or there's no other cancellations or interruptions in therapy. That means come January 1, you'd be eligible for an updated referral and a further 10 sessions for the next calendar year. So this is a great way to optimise the sessions and get a greater treatment dose within the 10 sessions per year. This option may not be viable for a lot of people. Often mental health requires a more urgent response, and we know that the earlier you intervene, the better the outcome. But for some people who have been having difficulties for a long time but are kind of coping okay in day to day, a few more months isn't going to be too overwhelming for them. This could also be an option. Number 4, claim the Medicare rebate on alternate sessions. Research tells us that 10 sessions is going to be adequate for only about 30% of the help-seeking population. The rest of us will need more than that. Most of my clients tend to come in about once every fortnight, and by the time we factor in holidays, illness, session cancellations, life interruptions, we may see each other about 20 times per year. Some of my clients have asked me to process the Medicare rebates on every second session they come. So essentially what happens, one session they pay the whole fee, and the next session they get a rebate for that session, and that way the cost is averaged out over the year. They use they get the 10 Medicare rebates across the year, rather than getting a rebate for the first half of the year and then having to pay a lot more on the back end of the year. Number 5, spacing sessions out. So another way of doing this is to claim the Medicare rebate for all 10 sessions, and then once those 10 sessions are used up, to space sessions out. So for some of my clients, they might go from seeing me every 2 weeks to maybe every 4 to 6 weeks after those first 10 sessions are used up in the calendar year. There's pros and cons to doing it this way. We know that for therapy to be effective, we do need to meet consistently, but for some people, by about the 10 session mark, they've got some symptom improvement, things are starting to get better, and they can do okay with spacing the sessions out further apart, and not too much momentum is lost in therapy. Number 6, examining other sources of funding. So again, this won't apply for everyone, but there are some funding sources, both internal and external to Medicare, that provide more than 10 sessions of psychology. Within Medicare, there's the Closing the Gap for Indigenous Australians, and also the eating disorders item numbers. So the eating disorders item numbers offer up to 40 sessions in a calendar year, and there's specified criteria for that. So your GP will be able to tell you more about that if you qualify for funding under that scheme. And there's also funding through services like Victims of Crime, and also Defence Force personnel for past or current serving members. Some non-government organisations such as Relationships Australia offer counselling on a sliding scale, and again, these services are not dependent on Medicare and not dependent on the 10 session. In Victoria, there's Head to Health, which is a free service that offers help with referrals to other services, and time limited. I think it's maybe up to 6 sessions of support with a mental health professional. I'll put a link to this contact in the description. Number 7, group therapy. Little known facts, but Medicare allows an individual to access not only 10 sessions of individual therapy in a calendar year, but also to access up to 10 sessions of group therapy. So you can have 10 sessions of individual and 10 sessions of group in a calendar year. Group therapy can be a bit more harder to find. It's not something, for example, that I offer. The logistics of setting this up can be a bit more difficult, and I guess with the last few years of COVID and not meeting in groups for people, it hasn't really been a thing. Therapists and clinics who practice DBT, for example, they commonly offer group therapy. And again, the university clinics, they will often offer group therapy either as part of a research project or an ongoing clinical program. And lastly, number 8, online therapy courses. So online courses can be a great way to get more education and get some practical tools and strategies for how to manage your mental health problems. Research into online therapy programs shows that while they are effective, they're not as effective as seeing someone face to face. And ideally, these programs are suited to people with relatively mild symptoms. This Way Up is a great program. It's been researched and shown to be effective. It's also free. I have an online anxiety management program up on my website, and I'll put a link to both of these in the description. So there you have it, 8 different ways to stretch the Medicare subsidised psychology sessions out. Hopefully there's something in that list that you can take away. Let me know in the comments if you have any more that you've come up with that I might have missed. Thank you once again for watching. Feel free to like, share these videos if you think they'd be helpful for other people, and subscribe to my channel. And I look forward to seeing you all in the next video.